Speech. This is Dr. John Bennett for Neuroanatomy TV. Today we have the pleasure of having Ipcherian. He's going to be talking about the cavernous sinus and the CR triangles, which I don't know. I'm not a neurosurgeon, but I'll find out. Okay, Ip, it's all yours. Thank you.
Yeah, good to see all the participants here. I can see Professor Hongo here. Is Professor Hongo here? Kazuhiro Hongo, is he around?
I don't, either he's there. I don't know if he's, are you there, Dr. Hongo? Perhaps he stepped away.
Okay.
Good. Hongo.
Okay, so I'm going to start. John, I'm going to start. All right.
Yeah, we're going to be challenged by the bandwidth, I think.
Right. So can you see my screen now?
Yes.
Yeah.
You want to put something on, right?
No, I am going to do frontotemporal craniotomy. Now, frontotemporal craniotomy, I'm going to focus on Cavernous Sinus triangles, and after that, I'm going to explain to you these triangles later on. First, I'm going to show you these triangles, how we get into these triangles. Muscles, and then we are doing simple anatomy. And once I taste, then
Yeah,
so
yeah, just hang in there. I think Ip is being challenged today by the bandwidth. So just hang in there. We'll just edit this out. He'll be back. He always comes back. While we're waiting, anybody want to say hello? This is free airtime.
Yes.
Hey,
Hello, Joe.
Saeed, how you doing?
Fine, and you?
Yeah, I got your request. You want Yuha's and someone else's email. I'll get on that.
Yes.
How you been?
Fine, fine.
Fine. Where are you now? Where are you?
Reunion Island, and my Reunion.
Okay, you're still Revision.
Beautiful island.
Right. Yeah.
Yeah. Right. Like it's quite here. We have little cases of COVID, but so
Boy,
not yeah.
Excuse me, Saeed. Okay, I guess we're going to be challenged a little bit today.
Okay.
I'm going to try and do this on my office computer. Let me just try this on the office computer.
Yeah. No hurry.
Give me a minute.
Yeah, the other connection is kind of rough.
Yeah, I kind of figured that. So I'm trying to do it on the office computer. I'm going to come in right now.
Yeah, just take your time. We need to get better somehow, though.
Can you see me?
Not yet. Hold on. Yeah, I can. You have to move a little bit if you want to. Oh, you fell off there. Okay, you're muted. I can't hear you. You're muted.
Yeah, can you hear me now?
Yeah, beautiful. Good voice.
All right. So, and the connection is okay?
Yeah, I think it's a lot better.
Okay, that's good. So now I need to select my videos from YouTube. So That's what we're going to do right now.
Okay.
Just give me a minute.
You're improvising. Good morning from Miami Beach. This is Dr. Bennett of Neurosurgical TV. We have another.
Hello, John. Can you hear me?
Yes, I can hear you. Your voice is excellent. That's a good mic you have.
Yeah, so we're setting up things one by one. So you see that?
Yeah.
So I got these connections done up. So right. So I'm going to show you this dissection video again. I'm going to share the screen first. Okay, sharing screen. You're able to see me there?
Yes. Yeah. That's much better. Much better.
Right. Can you see that right
Yeah.
now?
Yeah. That's
See
much
that?
better. That's much better.
Okay, John. Right. So we are going to do the frontotemporal craniotomy. And after that, we are getting the muscle down. So right now you can see my arrow. That's the orbit. That's the orbit. That's a zygomatic process of the orbit. That's a zygoma that I'm going to uncover. That's a temporalis muscle there. Everybody can see what I'm showing? Yes, clearly? Yes, Nilesh, you can see that. So what we are going to do right now is we're going to uncover this zygoma. So you can see the zygoma being uncovered from the orbit all the way down, but we are not going to use a FOZ. So I'm going to use a simple frontotemporal craniotomy. I was just showing how to uncover the zygoma, but I'm not really going to show the frontotemporal craniotomy. I mean, going to show the FOZ. So we are doing a frontotemporal, just a frontotemporal craniotomy. So that is being done now. The down part we are going to drill just like in FOZ where you drill this hockey stick, you're drilling that and then taking out that flap. Once those flaps are out, then our cavernous sinus dissection will start. So you can see the frontal lobe there, the temporal lobe there, the sphenoid ridge there. Imagine you're going to do a cystonostomy. You need to get in here, in this region. And to get into this region in a tight brain, you have to remove all this bone. That bone is what's going to hinder you. So you need to drill off that whole pyramid of bone. It's very, very important. So skull base is not the correct term, it's brain base. So to get into the base of the brain, you need to remove all this bone, and that's where the frontal lobe is folded onto the temporal lobe, and that's exactly where you need to get into. Okay, remember, as you young neurosurgeons, Most important part is anterolateral skull base drilling is this. You remove this. Once you've reduced that, you can see the V2 very clearly there. That's a V2. That's V2. And frontal, temporal, and orbit. The joining point, that is where you see the orbitomeningeal band. You remember that is a very, very important landmark. That orbitomeningeal band is extremely important landmark. Okay, so I'm going to dissect that orbitomeningeal band. And you're already going to start seeing the cavernous sinus now. We'll identify each triangle by triangle. So now what you're seeing is V1 here and V2 here. So once I cut this and I get into the cavernous sinus triangle here, now that this is not cavernous sinus, once I cut here and get into between V1 and V2, what triangle is that, Andrew? Nilesh? Nilesh might want to answer.
Okay, someone like to answer that?
What is between the anterolateral, I mean, what is, sorry, what is the triangle between V1? That is V1, okay? V1 and V2, what is the triangle?
Anybody?
Anybody, go ahead and answer, please.
Anterolateral triangle.
Is that anterolateral?
Yes.
Are you sure?
Yeah.
It is an anteromedial triangle, okay? But don't worry about this, okay? Don't worry about these names actually, because you can remember it as the triangle between the V1 and V2 rather than naming it as a triangle. But because of the conventional wisdom where triangles are named like that, that's why I'm telling you. See, can you see the extradural optic nerve there? That's the extradural optic nerve, okay? That's the orbital roof. I'm going now, this V1 is seen, V2 is seen. Now the cavernous sinus here is seen. And so you will have 3, 4, and V1. You will see each one of them. So that's the V1 there. You can see it through the membrane. And between the 3 and 4, between the 4 and V1, 4 and V1 has a very famous triangle. You know what triangle is between 4 and V1? Anybody? What is between 4 and V1?
Someone has a hand raised. Hamza, can you come on camera and answer?
Dr. IP, I think it's Parkinson triangle.
Yes, who's answering that?
I'm Reda from Jordan.
Thank you.
Very good, Redab. That is the Parkinson's triangle or the infratrochlear triangle.
Well, that's
See, now
Parkinson.
you are going to see these triangles very soon right now because there is a membrane. So you see, I am going to give you some triangles. One is between the optic nerve and the carotid, then the carotid and the third nerve, then the third nerve and the fourth nerve and V1, V1 and V2, V2 and V3, between V3 and GSPN, and then GSPN and the Peters Ridge. Okay, these are the triangles that I'm going to show you right now. Okay. So now it's becoming clearer and clearer. You can see the triangle between the V1 and V2 anteromedial, and you can see that's the fourth nerve. The fourth nerve and the V1 triangle is also clear. Extradural optic nerve and carotid you will see now. This dissection is continuing and you're seeing triangles right now. So you can see the fourth nerve there. That is the fourth nerve. That is V1. That is V2. And This is the third nerve. Here is carotid and extradural optic nerve. Extradural optic nerve. Okay. Once we open, you will see the intradural optic nerve also. So you can see the V3 there. That is the V3. That is the V3. That is the V3. All the triangles you're going to see now. Now, before you learn it didactic, you're going to see all these triangles first, and after that we will. So can you see the triangle between the V2 and V3? Yes? That's the anterolateral triangle. Huh? Between V1 and V2, can you see the triangle? Yes? Everybody?
Anybody?
Between,
Yes, Dr. IP, we can see it clearly. Thank you.
can you see the fourth nerve and V1? So can you see the Parkinson's triangle that you can develop? This is the Parkinson's triangle that you can develop, infratrochlear triangle. That's the fourth nerve seen through the membrane. And this is the V1. So you are seeing the triangle between the fourth and the V1. You can develop it all the way from the superior orbital fissure all the way back to the Gazerian ganglion, above the Gazerian ganglion. So you know why this triangle is very famous? Because these triangles, the V1 between the V1 and V2 between the V1 and V2 and V2 and V3, they are smaller triangles anterolaterally. Anteroposteriorly, they are smaller triangles because the Gazerian ganglion comes in your way. But between fourth and V1, you can go all the way from the superior orbital fissure all the way superior to the Gazerian ganglion. You have a very big triangle there. Okay, that triangle, if it is developed, you can see the C5 portion of the carotid, the C4 portion of the carotid, and you can see the meningohypophyseal trunk, all that you can see. Okay, right. Now that's a Gazerian ganglion. So triangle between V1 and V2, V2 and V3. Now this is V3 and that dural band is GSPN. Okay. So triangle between the V3 and GSPN. Okay. So laterally that's a Glascox. Medially GSPN, V3, GSPN and Peters Ridge. That is Kawasaki. Lateral to GSPN is Glascox. Okay. Don't worry about these names. These are triangles that you can. So you have a triangle between the optic nerve and the carotid, carotid and the third nerve and the fourth nerve and V1, V1 and V2, V2 and V3. Then triangle lateral to the GSPN, medial to the GSPN. So you got a lot of triangles you are seeing. Yes? Come on, guys, answer. Huh? You can see?
Yes, we can see, Dr. IP.
Right. Fine. So we are going to gently dissect much more posteriorly. So what triangle is that? That is a GSPN, that is V3, and this is Peters Ridge. So what triangle am I developing now?
Kawasis.
That's a Kawasaki. That's a Kawasaki. Yes, absolutely. Very good. So I'm developing the Kawasaki. So for the Kawasaki triangle, somebody has to be muted.
Go ahead
Can you
again.
hear me?
Go ahead again.
Yeah. So for the Kawasaki triangle, you know what is safe? The safer part is
Okay, just hang in there. We just froze a second. Okay, I think.
You hear me?
Yes, now we can. You froze it for a bit.
Okay, okay. Right. So this is the Kawasaki Triangle. Now we are going into something interesting. That is a fourth nerve. So fourth nerve and V1. This is the V1. So that is the third nerve, fourth nerve, V1. I have entered which triangle?
It's a Parkinson. I'm so sorry.
Yes. The Parkinson's triangle. Right. You have entered. That's a fourth nerve. Can you see the fourth nerve very clearly?
Yeah,
That's a
that's
fourth
clear.
nerve. Right. So there is a nerve coming from here, medial to the V1. It's coming like that.
It's the abducens.
Abducens. That's right. That's abducens now. So you have V1, you have abducens. And you know, there is a process there. There is a bone there. And then there will be a ligament on this side. What ligament is that? Which will be the roof of the abducens?
The Orellis canal, petrosphenoid ligament.
Yes, otherwise called the
Petrosphenoid ligaments or the Orellis.
Gruber's ligament. Yes, the
Gruber's,
petrosphenoid.
yes, Gruber's.
Yeah, yes. Very good. So this is very important when you do the Meckel's cave dissection. Meckel's cave dissection in petroclival tumors. If there is a tumor in this region, this ligament has to be cut. Okay, so you free the sixth nerve. To free the sixth nerve, the ligament has to be cut and the tumor has to be removed from here. It's very important. So fourth nerve, sixth nerve, V1, V2, and V3. Okay. So these are the triangles. Then you have the third nerve there. So that is the carotid there. Okay, that's a C. I mean, I wish I could show it more clearly. I have another video. Let me look for that video also. So, Nilesh, do you think you can copy that video from your iPad and give it to me in a new video? Give it to me on a pen drive or something. Okay, right. So we are developing the Parkinson's triangle. So you have V1, V2, V3, Gazerian ganglion. Right. So we have opened the dura there. That's the opticocarotid triangle. Okay. That's the intradural optic nerve. That's a carotid. Okay. Opticocarotid triangle. Very, very important triangle. Okay. So between the two optic nerves, you have interoptic triangle. Then between the optic and the carotid, you have opticocarotid triangle. Then between the carotid and the third nerve intradurally, you have the carotico-oculomotor triangle. And extradurally, between third nerve and fourth nerve, there is a triangle. Then you have fourth nerve and V1 triangle. Then you have V1 and V2, V2 and V3, then lateral to GSP and medial to GSP. That will take care of all your triangles except two triangles which you are not going to deal with it right now. I don't want to confuse you too much. Okay, so we are going to deal with the lateral carotid. You are going to see the lateral carotid triangle there. You can see the third nerve there, fourth nerve there, and that's a Parkinson's triangle completely developed from SOF all the way superior to the Gazerian ganglion. Okay. Now I'm going to remove this bony structure, which is the clinoid. Clinoid is being drilled off. optic strut is being removed. That's the extradural optic nerve, and optic strut is in the front of the carotid turn. So that optic strut is clinoid, and the optic strut is being removed right now. We'll see the optic strut being removed. The strut is there. That is the strut bone, optic strut. Below the optic and in front of the C3 carotid turn. So now you can see almost all the triangles. Optic, you've seen the carotid there. Extradural carotid is turning. See, C3 will be turning here and becoming intradural C2. That is your falciform ligament becoming the distal dural ring there. That's the intradural carotid, extradural carotid. Okay, optic nerve, falciform ligament becoming the distal and proximal dural rings. Optic strut is being removed. Okay, third nerve, fourth nerve, V1, V2. I hope you are enjoying this anterolateral approach. So that's a carotico-oculomotor membrane. What you're seeing as a membrane is a carotico-oculomotor membrane. I'm removing that's the carotid actually, extradural carotid. Removing the strut. Not the right instrument to remove it though. Made an opening into the sphenoid. Right. So you have optic nerve, carotid again, third nerve there, fourth nerve, which will come and overtake the third nerve at the SOF, V1, V2. So that's the extradural C3 carotid. That's the intradural carotid. Falciform ligament, distal dural ring. The transition of extradural to intradural carotid. That is where the transitional aneurysms are. Carotid cave, the so-called carotid cave aneurysms. And if you want to get proximal control for these large aneurysms, this maneuver is so important. Very, very important. Huh? So that is your carotid. So you put a hook here and you can cut all the way like that and then bring it laterally, and then you can dissect this dural rings also. So you can see the transitions very beautifully. Extradural carotid, cavernous carotid, C3, optic nerve, intradural carotid, third nerve, fourth nerve, V1, V2, V3. Clear? Clear? Everybody?
Yes, clear, Dr. IP.
Right, so let's ask some questions and all that. Okay.
Any questions? Anybody have?
Questions, please.
Yeah, I guess we're all set, right?
Comments, questions? Oh, wow.
Everyone's quiet today.
Is that me or is that somebody else?
Yeah, I think that's, let me see here. I think that's someone else. Let me mute them. Yeah, Hamza, I'm gonna mute you here. Don't mind.
Well, that's interesting music.
I don't know where that's from.
It's not me.
No.
No.
Wow. I don't know where it's coming from. It's
Is Dr. Kazuhiro Hongo still here?
So let me ask him to unmute. I see his name on the roster. He may have got coffee or something.
May I ask some question, please?
Yeah, go ahead. Go ahead.
Please, but this music is. Could you stop this music, John, for some reason?
Yeah, you know,
No, can you hear me?
Yes, go ahead.
You ask about the safest point for drilling Kawasaki Triangle.
Yeah.
May you explain it, please, if you can?
I will show you the Kawase drilling. Did you get the video? Okay, let me. You logged into you are logged in there. Is that video on your computer? Okay. Now, is it on your iPad? Can you start a Zoom session from your iPad? I will show you this drilling, okay? John, in the meanwhile, could you please stop this music?
Yeah, it's funny. It's not. I don't see it on the board there.
What's going on, guys? Welcome back into the Fantasy Bros YouTube channel.
Yeah, who's ever playing that music? Could you please? I don't see it on the mute on the board there.
Oh. Okay.
Is that on your computer, right?
I guess it is.
Yeah, it must be. Yeah, because you're the only audio open now.
Yeah. So I've got it. I got it under control now.
Okay.
Right. So you can see me now.
I can't.
Yeah,
You can't
Okay.
see. Are you sharing the screen?
No, I'm not sharing the screen. Pablo Hamse Al-Kawalde was asking something, right? Hamze was asking something?
Yeah, it's spelled as Al Khawalda.
Okay, Hamse, you. So what is your question?
Yeah, I'm just want you to show us the safest point for drilling Kawasaki Triangle.
Right. So let me just see if I can find that video. Nindesh, can you start a Zoom session from that computer? Okay. I found it from one of the older neurosurgical TV sessions.
Okay.
All right, I'm gonna go full screen and then I'm gonna share my screen.
Okay.
All right, Hamze, can you see what I am showing you? Can you see That's a V3. This is just a mirror
No,
image. Can you see this?
yeah, it's clear, but can you orient us about the direction and
Yes,
remedial?
yes, of
what's
course.
it?
Yeah. So this is the left side. So what you're seeing
So
is the V3 there. Can you see the V3 there?
You can see it okay?
it's clear. It's okay.
Okay, that's good.
Right. So that's the V3 that's being seen. And then you have the GSPN here. And that's a Peters Ridge there. And that's a Kawasis Triangle. So I'm going to show you. This is one of my sessions. So I'm going to show you how we put in a, we go ahead and drill. So that is a Gazerian ganglion. That is V3. GSPN is on this side. So this is the Peters Ridge. GSPN is on this side. V3, GSPN, and Peters Ridge. So arcuate eminence would be around this, and then we are going to drill it. So you can see now very clearly that is the V3, that is the Peters Ridge. GSPN is around here. I'm going to drill the Kawasis triangle. Okay. First I'll go and find out the carotid laterally. This is one of our old neurosurgical sessions. I didn't get my other dissection video. It's in the iPad, and I mean, unfortunately, with the iPad, I'm not able to get the speed that I need for. I mean, it's freezing. Right. So I am drilling this part of the Kawasis triangle just behind the V3, so that I have identified the carotid there. Can you see the carotid there, Hamze?
Clear enough.
Yes.
Clear enough. Clear enough. Yes.
Can you see that?
Yes. Yes. I can see it.
That's a carotid. So that's the lateral most limit. That is a GSPN now. Okay, I've gone underneath the GSPN and I put my dissector into the carotid canal. That's a carotid. Okay, I'm displacing that carotid there. That's a V3. That's a carotid. Okay, cochlea would be here.
Sure.
And so we will continue drilling. I have identified the carotid, so there is nothing much to fear. So that's the carotid there. And between the V1 and fourth nerve, I have identified a C5 carotid. That is C6 Peters carotid. And that is C5 carotid, which is at between the V1 and the fourth nerve. That is the C6 carotid. That's the C6 carotid, it's the Peters carotid. So now I'm drilling further. And you can see here the IAM opening. That thin bone is the IAM opening. I will open it soon. That's a carotid IAM. Okay. If you extend your Kawase from the carotid all the way to the IAM and even post IAM, and you leave the cochlea, the kind of exposure that you get will be massive, huge. You can do your petroclavels through this. I mean, not all of them, but a lot of them you can do it through this opening, and you will be devascularizing this tumor straight away. As soon as you take off this bone, you'll be devascularizing them. And you get such a large corridor to get into. Once you open the dura, you get the superior petrosal sinus and then cut the tent. Then the window that you get will be massive. taking off all that bone. You can go underneath the Gazerian ganglion. Okay, sometimes you can drill this V3 into the infratemporal fossa and mobilize the V3 so that you can go underneath and drill off the complete Petrus apex. All the way down to the clivus, to the inferior petrosal sinus, you can drill. That is what I am doing right now. So you have the posterior fossa dura there. That's a carotid. All this can also be drilled away. And you see, we are opening now. First opening is over the Meckel's cave there. You can see that's the posterior fossa dura. This is the Meckel's cave. I've opened the dura over the Meckel's cave there. Fifth nerve is freed. That is the fifth nerve coming in from the brainstem. That's the fifth nerve in the Meckel's cave. So that is freed first. Once that is freed, that's the anterior part of the pons there. Yeah, so what I wanted to show, okay, right now, that is the IAM opened, and that's the seventh nerve. That's the seventh nerve. That's the loop of Ica, the meatal loop of Ica. Okay, and that's the fifth nerve. That's the fifth nerve. So you can see the second nerve there, that's the orbit. Second nerve there, third nerve there, fifth nerve there, and the seventh nerve there. So once you do the Dollings and Kawasi, this is the exposure that you get. That's the basifrontal region. Okay. Thank you. I hope, Hamze, we made it very clear.
Yes, Chris, thank you. Appreciating.
Yeah, thank you.
Excuse me, someone, Dr. Bushan asked, can you please demonstrate the abducens?
Sure. I will demonstrate the abducens. Let me just... Okay, Bhushan. I am going to demonstrate the abducens for you. Right, so we're doing the clinoidectomy here before. It's optic nerve. That's a strut. Can you hear me?
Yes.
Huh?
Yeah, we can hear you.
My screen is not visible?
No, we can't see the screen.
Okay.
You're not screen sharing. No.
I'm sorry. 1 second. Okay, I'm sharing screen now. You can see now?
Yes.
Right. So you can see the Gazerian ganglion there. That's a V1 there. And that's a V1 under high zoom. So there I'm going to show you the sixth nerve, abducens. That's a V1. That's a Parkinson's triangle. That's a V1. That's a fourth nerve here. That's a C5 carotid. The paraclival carotid, C5 carotid. That's I've opened the Parkinson's triangle just like last time. And then we are going to show the sixth nerve. Sixth nerve, you can see it peeping out there. Can you see? That's V1, and you can see the sixth nerve peeping out there, just medial to. Can you see my arrow there? That's a
Yes.
sixth nerve. That's a sixth nerve. You see? I'll show you. I'll hook it out for you. Very soon, very soon. That's a C5 carotid. And see the sixth nerve. That's a sixth nerve. Beautifully seen there. Inside the Parkinson's triangle. So I'm going to hook it out for you. Don't do that in real time. Huh? Real cases, please don't do that. You'll end up with a sixth nerve pulse. That's a sixth nerve. Bhushan, did you see that? That sixth nerve very clearly now? That's a sixth nerve. Yes?
Yeah. I don't know if he can.
Yes, yes.
Okay, he said yes.
Yes. Good, good, good. Any other questions?
Harshad, are you there? Perhaps not. Any other questions, comments? Come on,
Any
you
other
guys.
comment?
Come on, you guys, get interactive. This is an opportunity. Don't be afraid. We'll get better with this tech and the use of the technology. Like any surgical tool.
Well, if there are no more questions, it's a tiring day for me, so I'd rather like to switch off, and I'll say thank you very much to all of you.
Okay, thank you.
We're just settling into Karad right now. This place is crazy, crazy busy with all those crazy cases. We've got now 3 consultants, including a consultant from Russia right now. We're having a lot of fellows joining us after the COVID. We're setting up one of the largest institutes. Whatever is out there, we're going to get it. We're going to get the robotic exoscope on which we are doing our work. So we're slowly setting up this department. It's not easy. It's a lot of work. So every day it drains me, but we've got our consultants, Dr. Nilesh and Dr. Trishant are with us, and Dr. Nargisa from Russia is also with us. This place is really busy, and I can see that in the near future, within 2-3 years, we'll be able to invite all of you, and you will see all kinds of skull base and vascular cases. And we'll be able to train you in the lab as well for anastomosis as well as skull base techniques. So I'm hoping that this Corona time gets over fast and we can set up our institute. Maybe in 6 months we should be set up. And we're going to have a grand opening for it in 2022 Jan, perhaps. 1 year we are keeping it. So 2022 Jan, perhaps. Because I don't know when these flights are going to open up, because 2021 September we have the Bogota conference. I'll see you all there. And 2022 Jan, we need to have a opening for this.
How was
welcome.
how was COVID there, like in Karad?
Well, it's burned through and it's gone. So
Okay.
nobody is really worried about the second wave or anything here.
Okay.
We're taking precautions, but it's nothing. I don't see any alarming news for COVID here.
Okay, I thank you very much for taking the time.
Can I ask the last question, please?
Yeah, sure, go ahead.
Okay. May I ask you if you have a fellowship program in your institution for neurosurgeon from outside India?
Yes, of course. Yes, of course. For sure, we will have.
You've hosted a lot up in Nepal.
Yeah. So
If it's
we will have.
possible, how can we contact them or
Yeah. So right now we are not entertaining people from outside because of the corona situation. But the moment the corona situation, that will be about 3-4 months. And once that is done, then you can contact me on my email.
can I get it, please, if you don't mind?
Yes, yes, yes. Nilesh, can you put my email on the?
Yes. Put it in the panel there so everybody can see it. It's Dr. Ipe.
Nikunj,
right?
can I call you? I'm on air actually. I'm talking. So after that.
No problem, no problem. No, I'll call you later. No problem.
Okay, can someone put Ipe's email on the chat? I can dig it up here if no one puts it
No,
there.
I'm writing it.
Yeah.
I put it.
Okay, thank you. DR.
Yeah, please contact me on the email and that
Okay,
should be
much
fine.
appreciated. Thank you so much.
You're very welcome. You're very welcome. Hamsi.
Thank you, sir. Thank you. Goodbye.
Yeah. See you then. Goodbye then. Bye.
Okay, Ipe, thanks a lot. And
Not at all. You're welcome,
okay,
John.
okay, we'll see everyone soon.
Yes.
And thanks everyone for coming. Okay, we'll end this here.